So my name is Eric Jude, and I'm from Compass Family Services, and I'm the Assistant Program Director of the Behavioral Health Services Program at Compass. Compass has actually been around for 100 years in different iterations, but really the focus is in supporting families who are facing homelessness to assist them in obtaining secure, stable housing and also attaining economic self-sufficiency and well-being for the family. So through a host of different programs at the organization, we're able to support families in San Francisco. And the key component here is families. So we're one of 3 different access points that a family can go to in the city. So we don't support just an adult individual, we support people with children, AKA families. Our interns, the sort of anchor of everything is the individual and group supervision. So interns come in and they know that they'll have that opportunity to really hone in their skills through individual and group supervision. In addition to that, and one of the things that we think really sets the agency apart is that it's more than just learning how to provide psychotherapeutic services to people. You also have the opportunity to be a part of a really dynamic social services agency. So as an intern, you're learning through the group and individual supervision process. Then you're also participating in something that we call the Counselor of the Day program. That program is in partnership with our Family Resource Center. So all of the access points in the city, all 3 of them, Compass being one of them, they have this aspect called a Family Resource Center. That's kind of the hub where a family or a family member can come in and be assessed for services, find out what it is, how it is that we can support them based on their needs. So an intern at Compass gets to be a part of that process. So you might participate in doing an intake with the family. You really get a chance to interact with the other programs. So for a Counselor of the Day shift, which takes place either in the morning or in the afternoon, depending on the intern's schedule, you're really a part of that Family Resource Center, supporting different needs as families come in with the staff of the Resource Center. And then the other component of it is an opportunity to be a Counselor of the Day. That's what we call it. So let's say someone comes in and they're figuring out what programs they have going on, but they also need a little bit more support. Maybe they're feeling overwhelmed. Maybe they're feeling just a high level of stress, and they need somebody to speak to. So they'd be working with a case manager for part of their needs, but then the intern has an opportunity to sit and support that person just for one session. So they get to really hone in, learn about crisis counseling, that kind of overarching title. Not everyone necessarily is, say, in crisis. They're just looking for more support in the moment. So you get to really build your skills around that, because that's really dynamic. You don't know who you're going to sit with. It's just one session. It's not this sort of traditional weekly 50-minute session. And you also get to, in those opportunities, listen to the other needs that somebody's there for in terms of programs, and just really listen to the stories, what people are experiencing that come to Compass. And then if it's needed, you can set them up with a therapy referral. Maybe that in turn will become their therapist, or maybe it'll be passed to the person will work with somebody else. But again, not only are you working in individual supervision, group supervision to learn your skills, there's also the Counselor of the Day shift. There's a couple different avenues that referrals happen. Some can be from another program, sort of the way I was describing. A family might come in will be assessed for which programs can support them. So a family might come in for one program, and then they might mention, say, on an intake form or in a dialogue with a case manager that they would like some therapeutic support. So they put in a referral. We work with Salesforce. They'll put in a referral that comes through our program, and that those referrals could be folks that get paired with one of the interns. Then we also get external referrals. So Compass has a partnership with the San Francisco Department of Homelessness and Supportive Housing. So what that means is that there might be shelters, transitional housing, permanent supportive housing sites throughout the city. Those case managers are able to make direct referrals to Compass Behavioral Health Services for therapeutic support for their clients. So we have internal referrals and external referrals that are really part of that city program. So it's again, dynamic is really the word for a lot of what's taking place in the way that we partner and work with our own programs and externally. Typically, it's working with 5 to 8 clients, so that's pretty straightforward. And it really all depends. There's times where we have a waiting list. Usually before the intern year begins, we're kind of figuring out what clients might be an appropriate fit for a newer therapist, and holding on to that wait list. But between 5 and 8, that really seems to be the key number. And if somebody doesn't follow through, and after 1 or 2 sessions they decide that they don't want to move forward, then we're able to have that flow of referrals so that caseload can stay as consistent within reason as possible. So individual and group supervision. So really, this is the key. As a trainee or an associate, where you really get to learn. Like, yes, you can go and take trainings through different organizations and whatnot, but this is the individual and group supervision is where you get to talk about your client, listen to other people talk about their clients, and really just start to connect the dots. What's happening inside of you? What's happening inside of others that you didn't even maybe realize could be an experience that people are having, really getting to pay attention to the transference and countertransference, and understanding who you are and how you show up as a therapist, working on that, doing your own reflection so that really helps you understand to be the best version of yourself to show up for your clients. And it's such it's nerve-wracking, it's scary, it's intimidating, all those things. I remember just like yesterday, sitting with my first client. Our interns get a lot of support. All of us in the program are sure to let interns know, like, if you have a question, if you're feeling all the feelings, don't hesitate to reach out. We make sure that all of our interns are paired with one of our staff therapists too, so that they have somebody else. So you've got the clinical director, the program director, myself, the assistant program director, and then the staff therapists. And of course, people that you get to meet from other programs. It's really all about working together. We're all here for one mission, to support our families. And we make it very clear, and we really try to create the atmosphere that our interns are part of that Compass family. We really view the internship as being the experience. Like, you never know what each day is going to hold. That's an important part that I think gets left out of the training, is being at the agency, taking it in, observing what's going on while you're on site. Again, being part of that family resource center, doing counselor of the day. I also didn't mention, interns have an opportunity to work at our Compass Children's Center and do therapeutic shadowing. So being paired in a classroom to support a child who, for example, might be exhibiting some behaviors that maybe a parent or a teacher has a concern about. And an intern can come in and be able to have that experience of working with kids from 3 to 5 years old. So for some of the interns who are really interested in that direction of work, that's an opportunity too. And of course, that training comes in working in that individual and group supervision, learning more about developmental stages, how to talk to parents, how to work with teachers, how to be at in a teaching setting and being a therapist. So that's an opportunity for training. Formally, training takes place in individual and group supervision. We're also sure to make sure that some really core aspects are covered in training. So for example, a couple things: charting or doing progress notes, suicidality, domestic violence, mandated reporting, therapeutic shadowing for folks interested, crisis intervention, and also learning some of the assessments that we use, two of them being what's called the World Health Organization Quality of Life Assessment, or WHO-QoL for short, as well as the Protective Factors Survey. These are different ways that we support our clients by trying to have a sense of what are goals in the beginning, have goals been achieved, and being able to do some kind of assessment. So at Compass, we have an impact and learning team. So we use data. And I would say that as far as social services agencies goes, we're pretty tech savvy. And all of us participate in learning about the data, interacting with our impact and learning team, and recognizing that data has a place and it can help us serve our families. And that even goes for our psychotherapeutic services. There's data that can help us. I think there's the classic concepts of working in an organization, being able to maneuver fast-paced. 1 minute you turn to the left and then a client walks in on the right and you kind of have your hands in one thing. Really important to be able to manage multiple things at once. That's really important. And to be able to be self-sustaining, to be able to come in, understand sort of how things are working. Of course, there's a learning curve at first. So being kind to yourself, taking it in, asking questions, really important if you don't understand. And other concepts too, the flexibility, being really curious. As a therapist, our curiosity is really important. And also really finding your flow in a social services agency. Be curious, ask questions, being collaborative. You're working as part of a team. You're going to be with other interns. You're going to be working with different supervisors, different program leads, and different staff members from, the staff who's offering childcare to families that are coming in to work with their case manager. We also have childcare if, let's say, a mom's coming in and it's really important to her as we come out of the pandemic to be able to do on-site therapy. Well, we can offer childcare for her children. So she can bring the kids in, work with our childcare staff. So being able to collaborate with all these different programs, and being patient. Social service agency, we're always changing. There's always a lot going on. And also just being creative, which is kind of like, okay, I need a solution in this moment. The office manager isn't here. There's a family member here, but what have I learned so far that I can put into action? So yeah, I think really being flexible on your feet really helps to lead to success. Folks that we work with, a lot of our families are experiencing present tense or have experienced a high level of trauma with a capital T, trauma with a small t, the full range of it. So in sitting, holding space, creating space, holding the frame for providing psychotherapy for an individual or a couple or a family or a child that has experienced a high level of trauma, it can be very intimidating at first, especially as you're just learning how to be in the seat of the therapist. So that's typically the most challenging aspect. So what that starts to get into is, how do I prepare for sessions? What is my self-care after sessions? When I sit with somebody who is telling me a story of trauma, how does vicarious trauma live in my mind and my body and my spirit? And what am I going to do with that? So I think the way to manage that is relying on the other members of your cohort, talking it through with your supervisor, being able to just have that dialogue with, maybe your peers and colleagues outside of the organization, your classmates at CIS. Also personal therapy, personal practices become incredibly important. Self-care is key for any therapist. And when we're talking about the trauma with a capital T, it really becomes even more important. And the key word is practice. Finding out what works for you, finding out what helps you to feel like you really have your feet on the ground in order to support other people to get their feet on the ground. You come to Compass as an intern to learn to be a therapist, and you come to Compass as an intern to be a part of a vibrant social services agency. It's also important to know that the agency is itself, Erica, the executive director, all of the senior leadership, all of the program directors, assistant programs, everybody that's involved, diversity, equity, inclusion, and belonging is important. Social justice is important. It's built into the mission. I encourage people, if they have any questions, go to the Compass website, learn about the programs, read the mission statement again, and really decide does it sound like you have the capacity to help us to support the community that we serve, and really think about, what are your goals? What skills do you want to build? And do we seem like a good fit for you? Because of course, we'll be figuring out if we think that an intern's a good fit for us, but anybody who applies to the program, make sure that you do your due diligence. If you do an interview with us, ask all the questions. We can handle all the questions. We want it to be the right fit for any intern that joins us.